Hey there, it's Eugene Kim, AAS recorder, and I can't believe it, but it's less than a month away for the Academic Surgical Congress in Jacksonville, Florida, and we're looking forward to seeing you all out there. Prior to the meeting, I thought it would be a good idea to put together a quick little presentation for some moderating skills. Some of you have moderated for years, but there are a number of you who are junior, who are just starting your moderating careers, and I wanted to give you some tips on how best to move along these sessions and facilitate the sessions so that our speakers and presenters get the most out of it. So getting right into our moderator tips, it's important to keep in mind the overall mission, and that's pretty much you've got to orchestrate the talk so things run seamlessly, stimulate great discussion, and keep things on time. That's it, pretty much simple. Overall, with the formatting, oral presentations are a total of 8 minutes for the talk, 4 minutes for discussion, so 12 minutes per presenter. And for quick shot presentations, 3 minutes for the talk, 2 minutes for discussion, so that's 5 minutes total for each presenter, with the 5-slide maximum for quick shots. With regard to the time, it's so critically important to monitor the time closely, keep the presentations on schedule. If it seems like the presenters are way deep in the weeds with their results, you might want to bring them back at about 1 minute to 30 seconds left to tell them that they need to wrap things up. Timers will be available at the moderator desk, and you've got to keep the time and compare it to the scheduled time and keep the session on time. With regards to discussion, keep in mind that you and your co-moderator lead the discussion. Every speaker should receive at least one question. If there's a lot of audience participants wanting to ask questions, defer to their questions over your own. And if there is no audience participation for a particular talk, make sure that you or your co-moderator provide at least 1 or 2 questions. This is the variable period of time, and it's really up to you in just balancing the session. Some presentations may garner more discussion than others, but in the end, it's up to you to keep things on time by managing this discussion time period. New this year at the Academic Surgical Congress are feedback cards. These are little cards that will be available at the moderator table, and they're intended to be brief and focused feedback about the presentation itself and not the content. So you quickly fill these out between talks. Prior to starting the session, inform the participants that these cards will be distributed to the speakers at the end of the session to encourage everyone to stay till the end. And remember, these are medical students and residents who worked very hard, and so be kind and be brief. As an example of a moderator feedback card, we have an example here. You just quickly write the presenter name and the abstract title. And then there are 3 major criteria we thought we would talk about. The length of the presentation. Was it too long? Did they go over time? The pace of the presentation. Was it too fast? Was it too slow? And then the quality of the slides. Was the font size too small? Were the animations distracting? Did the color scheme not go well? And then after you've numerically graded these, then you just briefly write a comment or 2. Spoke too fast, slides were illegible, animations were distracting, and so forth. Some of these speakers have talks in parallel sessions, so they should come to you at the beginning of the session to make you aware and ask if they can go earlier in the presentation. So please be accommodating if this is the case. Another role of the moderator is to be on the lookout for conflict of interest and bias. This is pre-screened before the presentations, and it should be mentioned at the beginning of the talk. But if it is not and you suspect there is bias, please report that to Christine Sass of the ASC. Some general tips. Try to review the abstracts ahead of time. Prepare a question or 2 based on the abstracts that you've been assigned. Develop a system with your co-moderator to how the talks will be loaded and who will be introducing the next speaker. And so usually you may alternate between these roles, between the 2 of you. And you want to coordinate with your co-moderator who will be responsible for which abstract and who's going to be asking the questions for a particular abstract. And again, it may be easy just to alternate. And keep in mind that there's support all over the place. There's an AV technician assigned to every room. There's ASC staff throughout the meeting. And of course, there are your program chairs, Becky White and myself, if you have any questions. We want to thank you for all your hard work on the program committee. It's one of the hardest working committee in reviewing all those abstracts. And I think one of the paybacks and one of the fun things about it is to moderate these sessions and get to know all these great presenters. So thanks again for all of your hard work, and look forward to seeing you in Jacksonville.